students, it's Dr. Elizabeth Hall, and I just wanted to introduce you to a very interesting person who's visiting the United States and discuss a little bit about his country. So, hi, so what's your name?
Hi, my name is Serhii. I'm from Ukraine. I'm directly from Kyiv, it's the capital of Ukraine.
And what do you do in Kyiv?
I'm a medical doctor, I'm a pediatric anesthesiologist, and at this moment my position is medical director, one of the biggest children's hospital in Ukraine.
Okay, one of the biggest children's hospital in Ukraine. Okay, fabulous. And what are you doing here in Panavidra?
I'm take part in program of exchange experience in organ transplant program.
Organ transplant program.
I came with my colleagues from other hospitals of Ukraine who also take part in organ transplant program to receive some new knowledge, new information about this area of medicine.
Great. And have you had some good experiences so far?
Yeah, I have possibility to discuss the question about organ transplant with specialists from Mayo Clinic and also from specialists from University of Florida.
Florida, okay, Gainesville. Great. We study global health, so we're very interested in learning more about the healthcare in your country of Ukraine. Can you tell us a little bit about how your healthcare system works?
In Ukraine we have combination of two systems. It's a government medicine and totally private system.
So government and private, two different ones, okay?
Yeah. First it was government and private medicine start developed maybe 15, 20 years ago. First from like a general practitioner system, simple investigation, and now it's totally private hospitals with full type of medical care. Start from investigation and finish for any kind of surgery, include cardiac surgery, even for children.
And what is so? And do you? So one would have to pay, I assume, for the private.
In private medicine, mostly patient pay themselves,
Okay.
or if he has medical insurance, that's not common at this moment in Ukraine. Pay insurance company, but maybe less than 10% of Ukrainian people have medical insurance.
Less than 10% have
Yes,
insurance.
I think so.
So most of them just pay cash. They just pay it.
Pay cash or use government clinic where government pay for your treatment.
Okay. Do you feel like the treatment is better in the private healthcare system?
It's depend. Usually in private clinic, better condition for patient. I mean,
Okay.
better clinic, have new equipment and so on. But in some government clinic also condition for treatment also very well. But of course, many of government clinic is not good enough and not have all necessary equipment. And sometimes have some deficit in medical staff.
And are the government hospitals found in both urban and rural areas, or are private insured? The private hospitals more in the cities, or is it?
Private hospitals mostly situated in the cities, mostly in the big cities, because in these cities more people who have possibility to pay. Because in small cities, in a village, usually people have no enough money to visit private clinic.
So what percent of the Ukrainian population do you think goes to private insurance now, since it's a relatively new entity?
It depends from type of medical care. If we talk about some simple things,
Okay.
I think maybe 30-40 percentage patient. If we talk about some complex surgery or I think maybe 5-10.
5 to 10%
Yeah.
would go to the private insurers. Okay, because it's so expensive.
It's so expensive. It's sometimes not acceptable price because if you have some complication, the treatment become longer and price going up. It's very difficult to our people. That's why usually, and not all of our patient trust to private clinic so much to go to do some complex surgery, because we have only maybe 2-3 really good experience clinic with best staff. Mostly this is clinic in Kiev that can provide any type of surgery with good result, and that have very good renommee between patients.
Okay. And do you work in a private or a public hospital?
I'm working in public government, yes.
Okay, interesting. And how has healthcare changed since the war, which started last February? How has that impacted your healthcare?
It's impacted a lot because, first of all, in many regions, it's impossible to give this medical care because many cities occupied at this moment, or even not occupied, but these cities all time receive some rocket hits, many hospitals destroyed. Other hospitals have some problem with medical supply because it was broken a lot of logistic way. But first of all, it's if we're talking about first 2-3 months of war, but at this moment this problem mostly fixed and we have no so big problem. But of course, if we talk about government sector of clinic, it's a problem with financiation because we have a very huge financial problem in Ukraine because all money spent to army, to weapon, to defend our country, and of course it's nobody can give enough money to develop of medical service. For private clinic, it's also was very difficult time. Many small clinics was closed totally because no patient. Most of our clinic first 1, maybe 2-3 months treat only urgent patient.
Only urgent patients?
Yes, because we must be ready to admission of patient with injuries. That's why all patients who require who not require emergency treatment was discharged, and many of them move out from their home region or even move out from Ukraine, especially if we talk about pediatric hospitals. They have no enough patients at this moment because many children at this moment were evacuated from Ukraine, and that's why children population dramatically decreased last 7-8 months.
What happened to the children who who had cancer and who had chronic conditions?
At the beginning of war, most of them maybe was evacuated to Europe country.
To European countries?
At least from our hospital, we have evacuated more than 100 patients with different type of oncology diseases. First to west part of our country, and after that to Poland, and through Poland to other European countries. At this moment, for instance, in our hospital in Kiev, we start our practice in full value, including oncology patient. That's why all our department that take care about oncology patient now full.
So it's full. You've got full beds.
Yeah, full beds, including this department who performed bone marrow transplantation.
Bone marrow transplantation. Wow.
And also we will start our organ transplant program.
You restarted your
yes,
organ transplant
we
program.
even
Amazing.
performed first 3 cases, first for our clinic I mean,
Oh,
first
wow.
3 cases of pediatric liver transplantation.
Wow. You had those this year.
Yeah, we
Those are your first
yes,
3 cases.
yes, we never did it before, and this summer, when we restart this program, we perform 3 kidney transplantation and first 3 cases for our clinic liver transplantation.
Wow. And what would happen, for instance, if there's like an air raid, if there were missiles or bombs near the hospital? What happens?
It's a huge problem in this moment, especially the last 2 weeks, because Russian start again very active bombing and rocket attack on our city, including Kyiv. Even during one of these attacks was killed one of my colleagues.
One of your colleagues was killed.
Oncologist. She went to. It was morning when all people usually go to the job, and she also went to our clinic, and unfortunately the rocket hit near the place where her car drive, and she.
So a rocket hit her and killed her.
Yeah, and killed her.
One of your colleagues. Oh, that's so sad. It's terrible.
Yeah.
So when they're attacked, you have to move all
Yeah, we try to move all patients to
to the basement.
so-called shelters. It's not real shelters, it's on the basement.
Just the basement.
And some of patients last 2 weeks stay in this basement full time, because it's very difficult to move them a couple times per day, because sometimes we have a lot of this air attack. And for instance, yesterday total amount of time that we called air alarm, it was more than 8 hours during the day.
More than 8 hours.
Yes,
there
totally.
There were alarms.
Yes, total amount.
Oh my! For the whole area of Kyiv, or just your area?
It was 4 or 5 times, and
Wow.
each of this time was 1 hour or more, and
Wow.
totally during the day it was a little bit more than 8 hours.
Oh my goodness, that's crazy. And what do you want people from the United States to know about the war, the Ukraine war?
First of all, everybody must understand that this war is not local war between Ukraine and Russia. It's war between civilian world and very aggressive and terrible enemy.
So civilians versus enemy.
Yeah, because Ukraine fight with Russia not alone. All civilian war, all developed country with developed democracy understand that it's not the war between 2 countries. It's the war between democracy and tyranny, and that's why it's very necessary to help Ukraine, because we must stop this process now in Ukraine to preserve possibility that this war will become in some other country.
So it's really democracy versus tyranny.
Yeah.
And you have to stop it now so it doesn't spread to past the borders of Ukraine to other
Now
countries.
Ukraine fight not only for Ukraine. Ukraine fight for all country in Europe and maybe in all Western, so-called Western world, because if we will not stop Russia, they will go forward to Poland, to Baltic countries, but not only Russia, maybe other countries who also think about some aggressive action against their neighbors, also will see that it's very possible, and nobody can stop them. That's why it will be a very bad example that this is aggression is one of the possible way of action somebody. That's why we must stop there, that not only stop Russia, but that other potential aggressive country also understand that if they will do something like that, whole world can stop anybody.
So, right, so sending a message to all the countries
Yes, of
that
course.
they can't do this. That
We all understand what about we're talking, what country we keep in mind in this situation. That's why it's not only dangerous for Ukraine, it's maybe dangerous in different part of our world, and nobody can feel in totally safety if we not stop this process now.
Right, that's frightening. Well, thank you so much for your interview, and you're going back to Ukraine
Yeah,
on Friday night, in the middle of the night.
yeah. My back way will take a lot of time because we have some problem with logistics. But I hope this Monday, next Monday, I will back home and see my family.
Yeah. Well, best of luck with that.
Thank you a lot.
We've really enjoyed having you here. Thanks so much for sharing a little bit about your wonderful country.
Thank you a lot, and thank all people from United States for great support for our country. Everybody in Ukraine feel this support, and really appreciate you for this.
Great. Thanks so much.
Thank you a lot.
Okay. Bye-bye.
Goodbye.